So Frieda Fromm-Reichmann was a German psychiatrist who came to America, but she described what she said was a strange reluctance on the part of psychiatrists to seek scientific clarification of the subject of loneliness. And she said that thus it comes about that loneliness is one of the least satisfactorily conceptualized psychological phenomena, not even mentioned in most psychiatric textbooks. And she said that it seems to be such a painful, frightening experience that people will do practically everything to avoid it. Well, the pandemic has been very difficult, and you know, we've all been isolated, especially in that first year before we had vaccination, and even really until quite recently. And you know, things are getting better now, but thank goodness. But yeah, this is from Britain, but it shows data that there's been a huge increase in people reporting loneliness and isolation during the pandemic. It does turn out that there are significant associations with social isolation and loneliness. We can't say that these things are actually caused by it, but they're strongly linked. So if you are isolated and lonely, then you have an increased risk of all sorts of physical illnesses, as you see listed here, even an increased risk in the long run of developing dementia, an increased risk of functional decline, and an increased risk of death over time. So this is pretty scary, right? So when you see this, you think, well, okay, maybe this is something that that healthcare providers should pay some attention to. Maybe your doctor needs to know this, and maybe your doctor needs to find out from patients whether this is a critical issue or not. And I would say, by and large, physicians and other healthcare providers are sort of aware of that, but it's not on their list of critical issues at this point. And that's something our organization with this project would like to change. So this is something, as a psychiatrist, we try to think about the biopsychosocial model. Some people would say the biopsychosocial spiritual model, thinking of Yogi Arka and his work and meditation. But what this means is that every individual, if you have mental health in the middle there, is affected by their biology. That's the physical state of their body and their being. The social environment and the larger environment around them, as well as psychological factors. And you can see them all intertwined there. They all affect each other, and each individual is truly different. When we work with our residents, training them, we say, in any individual, you have to think about all of these factors and try and understand the person with respect to all of them, to truly understand the person. And of course, you see there overlapping social and psychological. You've got relationships, and that's certainly critical. You have temperament at the bottom, which evolves into personality. And we have to remember, people are different. Some people are introverts, some are extroverts. Perhaps introverts need less in the way of relationships or active social contacts, or perhaps not. Important questions to think about. And you know, why is it that individuals who are lonely and isolated could end up becoming ill? And this slide attempts to pull it together, but the real answer is we're not actually sure. But we think that there are psychological factors that could actually affect our biology, our physical state. And certainly we know that stress, for example, can change inflammation, gene expression, endocrine changes in the body, a whole variety of things that could lead to illness. So there is some rational understanding of the fact that social connection is important, and for many people, it's a critical part of being well. And this document explains that social connectedness and the brain are intimately connected. And in fact, it states that, you know, if you don't have much in the way of social connectedness, there can be negative consequences in terms of your brain functioning. So loneliness and mental health, of course, are strongly linked. And there's a strong reciprocal relationship between loneliness and depression. So if you're depressed, you're more likely to be lonely, and if you're lonely, you're more likely to be depressed. Not always, but more likely to be. And there's a quote from the Harvard study of adult development, a very long study of adult life, saying that close relationships, more than money or fame, are what keep people happy throughout their lives. And those ties protect people from life's discontents, help to delay mental and physical decline, and are better predictors of long and happy lives than social class, IQ, or even genes. And they found that this proved true across the board among both the Harvard men and the inner city participants. So in this study, they looked at different individuals, some who were Harvard grads, and also individuals who were living in the inner city. And there's certainly data from Canada that if you feel more lonely, then you're more likely to report fair or poor mental health. The US Surgeon General said that we live in the most technologically connected age in the history of civilization, and yet rates of loneliness have doubled since the 80s. And one wonders about this. This is the number of users of social media platforms and the increase over the years, the rapid increase in Facebook and YouTube and WhatsApp and so on. And some people might say, well, that's great because these apps connect people. On the other hand, as we know, people are just on their screens all day long, barely actually talking to anyone directly. But some people would argue that, and young people in particular would say we're more connected than you old folks ever were. But in Britain, they took this so seriously that a number of years ago they actually appointed a federal minister for loneliness. No kidding. And they funded a campaign to end loneliness, very active campaign across Britain. And here in Canada, we haven't done this. And, I would argue that we should. There's lots been written recently, and these are 3 excellent documents, just to mention that the one in the middle comes from Canada. It's from our National Institute on Aging. And it's a terrific document. If you're interested, you can get it right off the internet. And it's particularly focused on older adults and isolation and loneliness. And on the right is a huge report from the National Academies of Sciences, Engineering, and Medicine in the US on this issue.